Hello, instructor and fellow classmates. Welcome to this week's edition of In the Clinic with your host, Brandon, the nurse practitioner student. Yeah, all jokes aside, this week we had a 17-year-old patient, African American male, who was persisting with cough and nasal congestion for the past 3 weeks. He's my oldest patient currently due to my pediatric rotation, so with the approval of the doctor, that's what we're going with. He's a known history with asthma, which is generally mild and persistent in nature. Patient's asthma symptoms are aggravated by missing medication or respiratory infections. He's had frequent episodes in the past. He reports a cough that began a few weeks ago with gradual onset and has remained persistent despite treatment. We did see him in clinic a week prior and started some treatment there. The cough is described as dry, not associated with fever. His cold symptoms include nasal congestion and discharge, and they have persisted for several weeks as well. He denies any significant changes in appetite or fatigue. The patient presented has been prescribed several medications, including albuterol and a recent course of prednisone. Last week he was started on Advair inhaler, and his mother reports that he's been compliant with his medications over the past 7 days, but the cough remains persistent. In addition to asthma, the patient's had a history of bronchiolitis when he was young, constipation, and he's declined flu over the past few years. Asthma, obviously, but again, he's had multiple episodes with flu-like symptoms over the past few years. Flu shot has been encouraged by the preceptor. His chief complaint says he's got a consistent cough with nasal congestion for the past few weeks. Prescribed medications currently are Advair, 100-50 micrograms per dose, 1 puff twice a day. Montelukast or Singulair, 5 milligrams, the chewable one tablet at night. Claritin, 10 milligram tablet once a day, because he does have some recurring allergies, and he does have an albuterol nebulizer machine at home. Currently he's done with his prednisone. I always like to start with the Olcart's example, just to kind of go through our process. Cough began more than 3 weeks ago. The onset was gradual and started with cold-like symptoms. The cough is generalized and affects the entire respiratory tract, no specific localization to the chest or throat, diminished airway throughout, normal inspiratory, prolonged expiratory. Cough has persisted more than 3 weeks despite intermittent treatment, including nebulizers and prednisone. Characteristics: the cough is described as dry, non-productive, and persistent, has remained in the same character with no noticeable change for those few weeks. Aggravating factors: worsens with missing his asthma medication, as well as respiratory infections in the past have caused similar issues. Relieving factor: slight relief with albuterol nebulizer, and there was some improvement with the breathing overall with prednisone, but he still has the cough. And tenderness to his sinuses. The cough's been persistent. Timing throughout the day, with no specific time of the day mentioned it being worsening. It does not seem to improve at all at night. And severity, while mild, is significant interference with daily activities, not associated with any fever or shortness of breath currently. Review of systems. General, he denied any changes in appetite, fatigue, fever, ear, nose, and throat. He admits to nasal congestion with persistent cough, denies any ear or sinus pain, just a little tenderness. Denies any chest pain, but admits there's a dry cough. Denies any shortness of breath at rest, but some with activity. No abdominal pain or changes in bowel habits. No rashes currently. He denies any past surgical history, family history. His father and mother are alive, but we don't know much of their family history. He was adopted. He does have 2 sisters, one with a seizure disorder and one brother that's healthy. Denies any smoking, no known allergies, denies any recent hospitalizations on top of it. The physical exam, generally pleasant, no acute distress. Eyes, extraocular movements are intact. Pupils equal reactive to light. Apologize. Went to clinical at 6 a.m. and got back at 7 p.m., so a little tired today. Ears, clear all auditory canals, intact tympanic membrane, swollen turbinates in his nose. There are tenderness and to the sinuses upon percussion. Throat, slight redness but minimal, kind of a glossy uvula, signifying some postnasal drip. Thyroid and neck, full range of motions, no issues there, no acute distress. Currently no wheezing, no rails, nothing like that. Heart rate, regular rate and rhythm, normal S1 or S2. Abdomen soft, non-tender, no issues there. Denies any constipation currently or diarrhea. He's alert and oriented times 4. Current assessment, we have a few differential diagnoses, sinus infection or acute rhinosinusitis, due to the patient's nasal congestion, stuffy nose, tenderness to the sinuses on percussion. This could suggest acute sinusitis. The persistence of more than a few weeks combined with their ongoing respiratory symptoms makes it plausible. Another potential differential diagnosis would just be an exacerbation of his asthma, given his history and the persistent cough, the fact that the asthma exacerbations are often triggered by respiratory infections. This could be a possibility. An upper respiratory infection is another possibility. Contingent on the discharge, the stuffy nose, which has persisted, could be possibly related to a respiratory tract infection. And then allergic rhinitis, I'll talk today. Due to them taking Claritin daily, it's not as plausible, but it can, again, present with nasal congestion, discharge, coughing, especially if it's not well controlled. We chose the acute reoccurrent sinusitis, as well as the chronic cough and mild persistent asthma with acute exacerbation. How we're treating the patient. Due to the chronic cough and the recurrent issues, we are referring him to a pulmonologist for further evaluation, just to rule out everything. We just started him on Augmentin, 825 by 125 milligram tablets once every 12 hours, continuing the Claritin. This is for the sinusitis. Preceptor does not take prescribing antibiotics lightly. That's why he's been back a couple times, just to rule out everything first. He's going to continue with the Advair 1 puff a day, or 1 puff twice a day, as well as the Singulair chewable tablet every night. We are going to follow up with him in a couple weeks and see how everything is going. Have a good one.